Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
You can now book and pay online for your certified lateral flow test at www.hsa.ky/appointment. It's fast, easy, and convenient. Certified LFTs are $25 per test per person. HSA's testing center is located at 131 Center, McClendon Drive, behind Foster's Airport. Walk-ins for certified LFTs are also available. Need a PCR test for travel? These are now only $75. Visit hsa.ky/appointment for more information.
Welcome back to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. I have with me Dr. Richards. Dr. Richards, hello, how you doing, sir?
I'm good. Thank you for having me.
So I know this is kind of the formality, but, you know, people like to know about the background. So tell me your history. What's your specialty in the world of cancer research and things of that nature?
My specialty is currently Haematology-Oncology, which is the study of blood diseases and cancers.
Okay.
And I currently practice here at Cayman Islands Health Authority, where I manage lots and lots of cancer patients.
I understand.
As well as there are other conditions that are not necessarily cancer, but conditions that have to do with abnormalities in the blood that I also manage.
Okay. You touched on it. We've been talking about that. I know it's a broad question, but just give me a little synopsis. What is cancer and what are some of the key factors about cancer?
Well, that's a very good question, and I'm pretty certain that if you Google or you do any research, you'll find a number of different definitions of what is cancer. But cancer is really the abnormal growth of cells within the body. And if you think of it as normally you're programmed to do things a particular way, your cells are also programmed to do things a particular way, and then suddenly there's an anarchy. Those cells begin to grow out of proportion. They are no longer controlled, and they multiply so rapidly that they become deadly to the individual who harbor it. So it's really just a real gross, rapid growth of cells in a way which is not controlled normally by the body.
And that's one of the things, like you hear of a lot of cancer patients say today they were fine, and in 2 weeks all of a sudden there's some sort of change. It's very rapid.
It is true, and that depends on the type of cancer and how aggressive that cancer is. So people, they're perfectly right. They're feeling fine today, and then by next week, they could be on the hospital
some issues.
bed. Yes.
Right. Well, let's touch it a little bit deeper. So is every tumor kind of life-threatening? Because we hear the broad term, someone has a tumor and it goes into those.
No. And a tumor is just a bunch of cells together.
Okay.
That's right. And not all tumors are cancerous.
Okay.
The ones that are cancerous are the ones which rapidly multiply and spread all over the body. Okay. And then to come back to your question, which is to say, are all cancer growths deadly? No. The broad answer is no. Okay. There are some that are very slow growing, and then you can, if you catch them early, you can remove them surgically or may apply a bit of radiation. And you have those which are more rapidly growing and may require intensive treatment, whether it's chemotherapy, immune therapy, hormone therapy, and other targeted therapy, including bone marrow transplant.
Okay. So in saying that, I guess there is very different types of cancer.
Several different types of cancer. And even if you want to look at, everybody hear about breast cancer.
Mm-hmm, yeah. That's a
common thing. There are several different types, and they all behave differently.
Okay. You don't hear that too often, you know. I mean, we're kind of on the outside looking in. We hear cancer and that's it. You don't break it down into variations, intensity, types. You know, you don't hear that very often.
And that is very true. And it is largely up to us in the field to really spread that message of what are the different types of cancer we're dealing with. You know, for example, just as an offshoot, sometimes we see research and you hear that, the drug cures a cancer or is good for a cancer. And we will take it and run with it and say, I need that green bush or I need this medicine because it's going to do that.
It cures cancer, but no, it's just slated that there has been some progressive research in that area.
One particular area. You know, several times patients will come and say, Doc, why don't you give me immune therapy instead? Because, you know, I know this person down the road and this person had this same kind of cancer in their opinion and they got immune therapy. And then you have to break it down and say, based on what your cells are saying. Every cell has a language.
Right.
And based on that language, then you determine what treatment you give to them. So not everybody immune therapy will work.
And see, we have to realize, and this is for my listening public, it's so individualized.
It is.
Me and you can have the same car, but we drive differently.
Correct.
And cancer reacts to different bodies different ways, even though it could be the same identical thing. Maybe I'm taller, maybe I drink more water when I would, you know, I'm just using that as an example, but it could be different for me than you.
Definitely. I agree with you 100%.
Wow. We've been talking about cancer throughout the day here. Of course, folks, with me, Dr. Richards. He's giving us a synopsis and a view of what cancer is and how our bodies and understanding it just a little bit better. Cayman, Dr. Richard, it's small, but we have a fair amount of cancer. I don't want to say patients here, but just it seems to be a hot topic. Very, very, very known. I mean, like when I was growing up, and you know, I'm kind of old. It was the big K. You know, you heard. I'm like, what the heck is the big K? But then, as we get older, we realize that they're talking about cancer. Is that kind of taboo in the West Indian culture to talk about that a little bit?
It is. It is somewhat of a taboo. People are getting a little bit more easy, but you're right. There are many people who just don't want to hear the word cancer. Right. I can tell you my own personal story. My uncle many years ago was dying from cancer, and he always said to me before, "Listen, Doc, if I have it, I don't want to know."
What?
Right? Yeah.
Wow.
And he thought he did. He believed he did, but he didn't want to talk about it, and he didn't want a diagnosis. So yes, there's still some amount of taboo. There's still some amount of thought that if you have a cancer, it means death.
Okay.
And it's not. That is not the case. It is dependent on a lot of things. One, it depends on the person's makeup. What are the other conditions surrounding? If it's a person who is very ill otherwise, have many other medical conditions,
right,
then that person is unlikely to be able to respond as well to the various type of the more aggressive treatment.
Okay.
Clearly. Two, some people talk about nutrition factors. Yeah, it's important to have a good nutrition to fight cancer. Three, it also depends on the kind of access to the most important care, medication and a team to take care of you.
Okay.
Right? Because we're blessed in the Cayman Islands. Certainly at HSA, we are blessed.
Mm-hmm.
There is hardly any medication that a patient with cancer needs. Repeat, there's hardly any. I'm not going to say absolutely not.
Right.
While we may not all stock everything all the time, you cannot do that. Inventory management tells you can't stock everything all the time. But we ensure that every single patient can have access to the best medication.
And I think that is a kudos to HSA and their commitment to the Cayman Islands.
Without a doubt. Without a doubt. The commitment, right? The commitment to the Cayman Islands.
In looking back, we always hear, prevention is better than cure and those things. If something is hereditary, if it's genetically disposed, and we have 3 or 4 members in our family who has been predisposed to this, wouldn't that make our chance greater?
It does make our chance greater. But what is important, once that is known that there is some hereditary component, it's very, very important education.
Okay.
Right? Education in terms of saying we're gonna start screening early. Right? And so that you can detect early. And the earlier you detect, then it makes it much easier to apply the appropriate treatment, right?
Okay.
There are those, and you'd have seen some, like some famous people who would have gone and had things like prophylactic mastectomy, means they're taking off their breast before they ever think of getting breast cancer.
Okay.
Right? And, I don't believe that this is really standard of care yet.
Okay.
Right? But these are persons who would have inherited a particular gene that brings a very, very high risk for that. And they probably had mother, sister, aunt, everybody with some of these cancers.
Bringing that up, Doc. So screening, how early, it varies, of course.
It varies on the type of cancer, and it also varies on what your family history and so on is before you begin to do all this screening. It wouldn't make sense for you to send a young 20-year-old girl to go and do a mammogram.
Right.
Not that you don't have breast cancer below 20 years old. I've had patients 16, 17 years old who have had very aggressive cancer.
Okay.
And, unfortunately, succumb to that. But it's very rare, right? But depending again on what has been happening to that person, then not later, probably by even 30, you may need to begin to do certain things. It's like also doing colonoscopy, right? There are different school of thought. There are those who start at 40, 45, 50 years old, depending on which jurisdiction you're in.
Okay.
But the importance of knowing when to start is, does this person have a strong family history of breast cancer or like colon cancer or, such the like.
Things of that nature.
Things of that nature. Is this person a smoker? These are different things that you need to look over.
Okay. And folks, we're talking about cancer and just the way how the global industry is looking at it, and also how Cayman as a HSA is taking a very keen look at it, because this improves the quality of your life. The sooner that you know about something, the sooner that you're aware of it, the sooner you can actually start treatment. You can start looking at different ways to go about it to improve your quality of life.
So, and again, one of the things that in management of cancer, it is about the continuity of care. We spoke about the screening. HSA provides from start to finish, meaning, so first of all, there's on and off public education as to what are the different things to do.
Okay.
Right? What are the different lifestyle changes that people may do to remain healthy? Because, we have cancer, but a cancer patient may have hypertension, diabetes, and so on.
There may be other
factors. So we look at patients as people, as overall people. They're not just cancer or they're not diabetes. This is a person who happens to have cancer, who happens to be diabetic. So we take care of the whole person. So as far as possible, when, whatever are the screening methods that needs to be done, we go ahead and we do that. Then from screening, at times, we may pick up things, maybe we may not, but sometimes even the patient comes in and say, look, I'm having symptom A or B. A woman may say, listen, I was having a shower and I feel a little lump here.
Right.
Or somebody will say, hey, I go to the toilet and I see some blood. Or my bowel habits are not exactly the same. I have constipation this week, I have diarrhea next week, I feel bloated, I feel a bit of cramp now and then. And so we go with an intention of deeply investigating whether this person have one cancer or the other. So the first is screening. When this person has no symptoms at all, it's really to detect something very, 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 very early. Then we go to see, okay, somebody presents with a symptom. And the HSA provides in any avenue, whether it's been radiology, where we have to do various scans, right? Whether it's going to the surgeons, where you have to do biopsies, or the radiologist does biopsies for diagnosis. Whether, depending on it, you come across to the oncologist, like myself, depending on what is happening to the blood, and then I may look at your blood and I may do a biopsy on you, right? And so the next aspect is diagnosis. Once we have diagnosed, we have the capacity at HSA to manage most cancers. I say most because there are a few which we prefer not to manage because the capacity on island, is for example, somebody who presents with what we call acute leukemia, which is a cancer of the blood, right? It's a very, very aggressive, rapidly progressing disease. There are certain things that you need, the kind of support that you need, and including perhaps even bone marrow transplant afterwards. So it is best if some of the patients like these are managed overseas. And nobody here in Ireland manages them. Right? So I said there are one or two. And so in general, we provide whatever treatment is necessary, and it is according to the very best guideline. After that, we hope that we will cure some patients, or at least send them into remission. Unfortunately, this is cancer. Most times there's no clear-cut cure. People go into remission, people relapse. That is an unfortunate thing. But we also provide that kind of palliative care where we continue to manage people, although they have a cancer on board, because the aim is to make people as comfortable as possible and to make them as pain-free as possible and to stop that cancer from moving forward, at least in a rapid pace. There are, of course, certain treatments that are not available on Ireland. I hear that other people are planning on setting, like, for example, radiation therapy. We have 1 or 2 patients per year who need that, right? And of course, we will send them to a center outside of the Cayman Islands where they may go and have it. But apart from that, the continuity of care that we provide at the Cayman Islands Health Service Authority is top class. It's in every single area. And I remember I said to you earlier on the whole aspect that we don't look at any patient as a cancer patient. We look at each person, John Brown or Mary Jane, as an individual. An individual who needs nutrition, who needs psychological therapy, who needs to see the kidney specialist, right? Who needs to see the internal medicine, who needs to see the surgeon. And we provide that kind of continuity of care that is really second to none here.
And I think that's the thing that I love about Cayman and the HSA is that I've been to places where you're number 5, 4, 3, 2, 1. Okay, Mr. I'm like, it's a very cold feeling. You don't feel very human there.
And that is the thing that we preach at HSA. When patients come there, they must not feel like just an ordinary patient. Every one of our patients, they feel like they're family. They come in and they feel they belong. They feel they are cared for.
And that's the thing I think, that we understand the risk of cancer. We understand that cancer realistically can catch you at any age.
Definitely.
And so with that, how do we make sure that life continues?
Correct. And one other thing that we have been doing, it is also ensuring that our patients, not only our patients, but their caregivers, we try to offer, and I use the word try to offer, as much psychotherapy as possible. Because when cancer affects one person in the family, that person may be the key breadwinner, you know? And so that person's life is impacted, but also the people around him or her.
Okay.
And so we look at everybody as part of care, not only the individual directly getting the treatment, but the support around them. We try to give them as much as possible.
And I think that is a great thing, because it's even though cancer is affecting, as you said, one person, it's the whole family unit that has to deal with it. So some people may deal with it better than others, and they may be at work, and somebody who can't deal with it may be at home. So you need to have everyone kind of on an equal playing field, so we all know what to look for. We all know how to do this. You know, the information has to be a whole. And I think that's one of the things that, you know, HSA has done and is doing quite nicely in
and
getting
will continue to do.
And continue
and will continue to do.
And continue and hence the reason why we're talking about it today. Because I think this is the first time I've actually talked on air about cancer in this depth. You know, and I think it's a good conversation. It's a conversation that needs to be held. And it's a conversation that needs to continue, not just for 1 month or 1 week, but, you know, we're glad we highlight it for the time frame, but it needs to be a continuing information giving. And thank you for that.
You're welcome.
And so we've been talking about the management. Give me some of the broader term management.
So the broader term management, I mentioned to you that patients, you know, the in thing nowadays is immune therapy.
Okay.
Right. And there are various different forms of immune therapy.
What exactly is immune therapy for somebody
well, so for somebody who have cancer, and remember I mentioned before, all our cells are labeled, literally. And so, you know, when somebody has a cancer, what we do, we send it to a reference lab that will look to see what label does it have on it. And the label it has on it will determine whether or not, so immune therapy is using special drugs that are not chemo drugs, but what they do, they can identify those labels on the cells and either stimulate those cells to produce things or they block it.
Okay.
Right? They block it. So they can stimulate one thing or block something else. That's generally how immune therapy works. So it's really getting the immune system to respond in a particular way.
Okay. All right.
Right? So we have been offering this for many, many, many years. We offer immune therapy. We have been offering it for many years. It's nothing new. What is new is what's coming out today and tomorrow and next week, because I can't keep up.
Really?
Every day there's a different type of immune therapy or what we call targeted therapy that's available. We offer the...
and it's so funny you should say that, because I remember reading a couple of months ago, they were talking about, I know folks, the sidetrack, but in my industry, all of the weird news kind of go, and they were talking about, this person had dog allergies, and they were using immune therapy to block the allergy.
Exactly.
Okay, all right.
That's exactly the
case. I mean, it's a different idea, but it's still...
Because I said either it will stimulate you to produce different hormones, different chemicals, or it may block those.
Okay.
Right? And then what happens? How cancer manipulates the immune system. That's what it does. It manipulates the immune system. And so the idea is, you are either going to create a decoy using immune therapy. So the cancer cell believes that what it is seeing is actually the normal cell, right? So you trick it. Or you have immune cells that have even medicines attached to it that stick to the cancer cells and literally blow it up.
Okay.
Or you have different one that blocks the cancer cells, so they compete for a particular spot on the good cells. So it will outpace the cancer cells. So when the cancer cell come around, it can attach to the good cells, so eventually die.
Okay.
You know, in general, in broad layman terms, that's exactly
right.
That's exactly what
Of course,
happens.
folks, you have to understand. He's talking years upon years of research, and we're kind of condensing it for our listeners and also for me, because you know this is fascinating to understand. You know, the human body is a fascinating vehicle, I call it, because each one drives and moves, manipulates differently, and so to get the understanding that, you know what, this can help is wonderful.
Right. So immune therapy, while it is good, that what happens with these targeted therapy, target, it goes directly to one spot, you know, but they do like everything else. So people say, give me the immune therapy because it's safe and so on. All of them have side effects.
Okay.
Right. Then we also have chemotherapy. And chemotherapy is most times injections, and it may come in tablet form as well. And there are many different types and the different parts of the cell that it can attack. Chemotherapy is less targeted.
Okay.
But you have some chemo that will work better with breast than with colon, than with a tumor in the brain. You find that different cells are more responsive.
Exactly.
Then we have what we call endocrine therapy, which is hormone, different kind of hormone. And we use that a lot in two big cancers.
Okay.
Breast, prostate.
Okay.
These are manipulating the hormone.
Man and woman, basically, in a nutshell, right? And I mean, which brings me to my next question. You know, we talk about breast cancer fairly quite openly, but men have a large prostate cancer that has been basically kind of underlying that we don't talk about. And I mean, anybody over the age of 45 and 40, as male, we should be thinking about this. Tell me a little bit about that.
And I agree 100% with you, and especially in the Caribbean, there is a very, very high prevalence of prostate cancer in the region, right? Jamaica has an extremely high index, and I would assume with so many Jamaicans in the Cayman Islands, there's a fair amount. I don't know what the exact data is here. Amanda will be able to tell you much better,
yes.
Right? But the problem with this is that the physical examination, men, especially in the Caribbean, don't particularly like to subscribe to a rectal examination. It's important. It's part of, just like how a woman has to embarrassingly sit in front of a doctor and she derobes and he examines her private parts. You know, it's the same way that it's important to have these organs examined. Cervical cancer is another one of importance. You know, that's in the woman.
Right.
And so it's important to have regular, at least once a year, once you've passed 45 up into the 50s, and especially if you have family history, to go to your doctor, have a digital rectal examination as a man, because that sometimes, a lot of time, picks up a cancer that you can potentially get rid of.
Right, and it's about detection early.
Early detection. That is the key.
And I tell people, I said, you know, I know people that don't see the dentist. I said, I understand that. You know, I understand we have a fear of anything with doctor. you know, and I tell them, I said, and I talk to guys. You know, I said, guys, you know what? It's only one health you have.
It is. You only have one chance.
This is it. So why not? You know, we're in an age where we have all of these wonderful opportunities to enjoy life. Why not take advantage by making sure that you are around to do it, and also have a qualified person tell you about it? Because you know, I think most West Indian family, we all have some, you know, undisclosed doctor in it that knows every remedy for any illness.
Yes.
And we kind of subscribe to that.
Yes.
You know,
it's part of our culture.
Right. It's part of our culture. But then we do need the professional look at the situation. Yes. And I think that's one of the things that we fall short of. And I'm glad that HSA is accommodating, because we see doctors that we know. We see doctors that are friends.
Yes.
That we can have a real frank conversation with. And Miss Amika said you are the quintessential best person that she's run into, and you know, she swears by you. And she said, Chuck, make sure you have that conversation. He knows how important he is to me, because, you know, I saw the quality when she talked about you. I didn't see just a doctor. I saw someone who generally cared about her and cared about her well-being.
But that's one of the things that makes me love HSA so much. It is their greatest assets are the people who work there, right? And the quality of the staff, not only academically, that's a given.
Right.
That's a given. But the quality in terms of that human touch is really, really, as I say, comes out of the top drawer, because it's about caring about that individual in front of you. That's our greatest asset. And it is something that we hold very close to our hearts.
Very, very true. Folks, we're getting set to wrap up. You're listening to HSA Today with your host, Chuck Taylor, and I'm talking to Dr. Richards. And I'm gonna try to pronounce all of the things that go with your name. And that's hematology, oncology, and you also do chemotherapy on top of that.
Yes.
For good measure, he covers all of the basically blood disorders.
Yes, I do.
Okay, I getting there. Cancer Survivors Day. Tell me a little bit about that.
Well, it is a very, very important part of our everyday life. You mentioned earlier a number of people who are walking around, and you don't know, but they are survivors. And it is a time when we really go back and we recognize them, and, you know, recognize what they have been through. And we are just happy to be part of recognizing these people who are there. And also, one of the important things, as Amanda would have explained, it's about looking at our data and our information. What's our survival data, right? We'd look at that. We look and understand what our survival data is, right? And it's those people who are alive who are really part of letting us know what is happening.
And see, and that's what we was talking with Miss Amanda, the cancer registrar, and it's important because, remember, people, this data is voluntary here in the Cayman Islands. There's not something that you have to do. It's something that they're asking you to do for the information, so they can continue in the research, continue to make the best choices and best decisions according to what we need, because we are different. We're different from Scandinavia. We're different from Canada. We're different from America, England. We have different needs and different thought process for our community than anywhere else. And I think that is the reason why, you know, if you have had cancer and you're surviving, you're working day to day and just living, that is a plus. And I think, you know, we should, you know, add that research into our community. I definitely think so. And so, Dr. Richards, in closing, any parting words that you want to say?
Cancer is no small thing. Surviving cancer is no small thing. We want to recognize those people who have survived it and all those people who have not survived it, because it's no small thing. We want to assure everyone that, hey, look, we care, and HSA is doing everything to make sure that from start to finish, from prevention straight through to remission, we're there to help, and we're there all the time.
Perfect. Thank you so much. We will be back for another enjoyable and informative and sometimes entertaining. We drop a little joke here and there, but it's all about you, Cayman. It's all the information that you need to enjoy and continue on the great path that the HSA is providing for us. Thank you so much. Keep it right here. This is Bobo 89.1 FM.